As your practice grows, it's so important to be able to stay organized and keep on top of things, especially when it comes to documentation, filing insurance claims, keeping appointments straight, and getting reminders to people. Well, there's a great solution for all of that, and that is TherapyNotes. TherapyNotes is the leading electronic health record system for mental health providers. It's who I use in my practice. And so go check them out today, therapynotes.com. And if you use the coupon code Gordon, just GORDON, you can get 2 months free. So check them out today, therapynotes.com. This is the Practice of Therapy podcast with Gordon Brewer, helping you to navigate your private practice journey. This is session number 129 of the Practice of Therapy podcast. Hello, folks. I'm Gordon Brewer. Glad you joined me for the podcast. If you're here for the first time, glad you're here. Glad you found us. Hope you'll take time to subscribe to the podcast wherever you might be listening to it. And if you're coming back for more, glad you're back. Glad you listen in every week. Hopefully you listen in every week. If you don't, that's okay too, but glad you're here. Glad you, are letting me into your ears and into your lives and, just with me on this journey. It's amazing to see the number of people that are listening and just how this whole community is just kind of growing and expanding. I'm looking forward to you hearing from my guest today, Jeremy Zug, who is the founder of Practice Solutions. And, one of the things I was thinking about, this morning as I was walking, kind of my normal routine for most weeks is, most mornings I will get out and walk and listen to podcasts and, just do some reflection and kind of meditating as I walk and that sort of thing. But one of the things that I was just really thinking about today was just how much life has changed over the last 2 months and just how much all of us have had to do to kind of change things and get into this new kind of routine around social distancing and that sort of thing. And I know one of the things is earlier this week I had a staff meeting with my staff, and we were just talking about the possibility of kind of returning to the office and starting to see people face to face. And I know there's been a lot of discussion about that for therapists and just really trying to figure that out. And I don't know that there's any right answer around that. I think all of us have to do what is comfortable, what is best for our clients, and also best for our own safety and that sort of thing. I know one problem that we've run into in my own practice is people that don't feel secure in being able to meet from their homes in terms of they can have internet access and they can do the video conferencing, but they worry about people listening in. And so that's one issue that we've come up against, and trying to be flexible with clients and being able to do what is going to serve them best is just kind of what was on my mind this morning. And for me, that's a great segue into thinking about what Jeremy is going to be talking about is mainly like telehealth best practices, but also just thinking about accepting insurance in your practice. And I know there are two schools of thought on that, in that there are those of us that are on insurance panels and accept insurance. And then there's other folks that are just strictly cash pay. And as Jeremiah, that's his proper name, but Jeremy and I talk about is just, I think you have to decide what is going to be best for you and for your practice. Certainly being a cash pay practice or cash pay business is much simpler easier to do, all of that sort of thing. But then we have to take into account our clients and the demographics of our area and that sort of thing. So Jeremy and I have a conversation about all of that because it's an interesting topic to talk about. One of the things I wanted to update you on is the Session Note Helper, which is a system I put together to be used with Google G Suite, or with the tools of G Suite, in particular Google Forms and Google Docs. Is I've updated the system a little bit. And when I say updated the system, it's not a software. So I like for people to understand that the Session Note Helper is not like a software that you buy. What you essentially get when you purchase the Session Note Helper is a set of templates and then a set of instructions and tutorials that walk you through how to set this system up, so that when you go to create a progress note, you go into a Google form, you fill out the Google form, check off what you did in the session, what you're working on with that client, all of those things that we normally do in a session. And then when you click the submit button, it generates a narrative of what you did in the session. And that's in a Google Doc format. And so it really cuts down on the time it takes to write a session note. And so anyway, I've come out with the 3.0 version of that. Still updating the website a little bit, but you can still get it if you just go to practiceoftherapy.com/session note helper, or you can go to sessionnotehelper.com. And what it is, how it works, just to kind of give you an inside scoop here on that, is that it uses an add-on called Form Publisher, which is how I originally started the Session Note Helper. But the problem was you couldn't get a BAA from Form Publisher in order to make it fully HIPAA compliant. Well, now they will provide the BAA, which is great news, because I had switched over to using an app script that I had a developer develop, and it was just running into a few little problems here and there. For some people, it would work really well, and then people were just kind of struggling to get it to work correctly. So I've switched back over to promoting kind of this Form Publisher add-on to use with the Session Note Helper. If you already have the Session Note Helper, you should have gotten an email from me that just tells you how to switch over to the Form Publisher and do those updates. And so anyway, it's out there. Just wanted to let you know about it. It's been just one of the most popular resources I've got available. And when you go to purchase it, it takes you to a website called Gumroad, which is a platform I use. And when you purchase it, you get a download, which is the startup guide, which is just walks you through the instructions, plus gives you a link to the video tutorial that I put together, all of those things. So anyway, just want to commend that to you. So anyway, that was a lot. So I don't want to wait anymore. And let's get to my friend Jeremy Zug from Practice Solutions and our conversation about taking insurance billing, and telehealth best practices. Well, hello, everyone, and welcome again to the Practice of Therapy podcast. And I'm so happy to have with me again somebody that's not new to podcasting or new to this podcast, and that's Jeremy Zug from Practice Solutions. So welcome, Jeremy. How are you doing?
Hey, Gordon. Thanks for having me back on. It's good to see you again.
Yeah. So Jeremy is my go-to person around all things insurance billing, and his company, Practice Solutions, is one of those companies that I absolutely love, or who I use in my practice, and we couldn't do what we do without them. But I wanted to have Jeremy back on, just given the time and the season we're in. Hopefully by the time this episode comes out, we're hopefully feeling kind of the tail end of the effects of COVID-19, but I think it's going to linger with us through the summer, unfortunately. But anyway, wanted Jeremy here. So Jeremy, as I start with everyone, tell folks a little bit more about you and Practice Solutions, and for those that might not know about you and your whole journey.
Yeah, well, thanks for that, Gordon, and a little bit about me. So, my wife and I started Practice Solutions to meet a market need of billing and credentialing as a source of relief to help providers focus on patient time or time with patients anyway. And so I'm from community mental health. I've been working in community mental health since I was 14, worked with patients at 18, have a bachelor's in counseling. And then my trajectory changed when we started Practice Solutions. But we exist fundamentally to help providers focus on patient care by removing one of the most Byzantine parts of private practice, and that's dealing with billing and credentialing.
Right. And it's, I know that they have been maybe I'm a little over dramatic by saying this, but a lifesaver in terms of my practice, in terms of just helping us navigate all the crazy things that can come up with insurance billing. But Jeremy and I were talking about, before we started recording, just some of the trends he's been seeing with just billing, and particularly for those of us that are in private practice, and we're on insurance panels, and we really kind of depend on that for our livelihood in terms of being paid, and also just helping patients. I think there's lots of reasons for people to be on insurance panels. But Jeremy, tell folks just kind of what you're noticing with all of this.
Yeah, so there are a couple of trends. I think the first trend that we need to talk about is the wide sweeping statements that insurance companies have made about patient responsibility as it relates to telehealth claims, right? Because almost all of the practices we work with went fully remote, right? They did the telehealth thing, and a lot of them were counting on and made statements to their patients that copays and deductibles would be waived, right? All patient responsibility and cost share would be waived per the insurance companies, right? And what we are starting to see is that insurance companies are and they're not. And this is probably one of the hardest things, right? Because patients and how they perceive your practice and how the billing functions within that is really critical. And so to have sort of what appears to be a bait and switch, it's not a bait and switch, but it feels that way.
Sure.
Is not super comfortable. So the first thing that we want to talk about here today is how to determine whether your patient's cost share will be waived, right? Whether they owe you a copay or a deductible before you submit a claim. And, fundamentally there are some good resources, but the best way to do that right now is to call the insurance companies. And you're going to want to repeat the script, right? You're going to want to say, is telemental health covered on an outpatient basis for this patient, right? And then give them the insurance information and the date of birth, because that will lead the provider rep to tell you what they have. What we're seeing as a trend is if the patient had telehealth benefits baked into their benefits before COVID, that's covered at 100%. If they didn't, the patients still have copays and deductibles applying through this time. And that's confusing for a lot of people. But as providers and as for us as a support structure, we can do the best job we can by being as clear as possible, right? It's Chris Hogan that says to be unclear is to be unkind, right? So we want to be as clear as possible with that. Right.
Yeah. So are you seeing a trend of just claims being rejected? Even, we're trying to make an attempt to put the right modifiers and all that kind of stuff with that. And for those that don't know, maybe it might be good to kind of mention maybe just a few basics about coding in terms of a modifier and what that is and all that sort of thing.
Yeah, the billing and coding errors are not, from our perspective, our vantage point, at scale not being rejected and denied. What we are seeing is inconsistency in the claims processing. One of the errors that we are seeing on the billing and coding side, and I know that providers hear billing and coding And it's almost like I switched from speaking English to speaking Greek. I mean, it's almost that dramatic.
Yeah.
It's a language unto itself. But there are two codes that are important, right? Critically so. Even if you're going to do telehealth beyond COVID, which is what I think is going to happen, Gordon, I think we're going to see one of the consequences is long-range telehealth sessions, right? But two codes that are important, and it's your place of service code, which if you're using an electronic health record, the practice settings feature of your electronic health record will help with that. But that code needs to be 02. Normally it's 11, which says that I'm conducting therapy in an office. Mm-hmm. But right now we're all conducting therapy, telehealth, remotely. And so what that code does, 02 communicates to the insurance company, all right, this was a telehealth session. You'll still bill with your office address, but you'll need that 02 code to delineate a telehealth session. The other code that's important is called a modifier. And if you Google modifiers in general, what you're going to find is a variety of answers, because modifiers in medical billing and coding can delineate which side of the body, left or right, up or down. So they're a directional code, but in mental health and in telehealth sessions, a modifier delineates two things. Telehealth, whether it was done via a phone or AV, right? Zoom or some other like DoxyMe, right? So where there's video and audio, or whether it's just phone. So the modifiers there that are important to note are either GT or 95. And depending on the insurance company that you network with, they've told you which one to use. Sorry about the dogs. I'm at home.
That's okay. That's all right. Yeah. I might have a cat show up, so it's all right.
But your insurance company will say, use GT or 95 as the modifier of choice.
Yeah. And I think that's, I think one of the things that's nice about using like an electronic health record system, I know that you guys are familiar with TherapyNotes, which is what you guys primarily use for the one that you recommend. But I know it's just a matter of just simply changing it from office session to online session just within the appointment itself. So it makes it pretty simple.
Yeah, that's right. That's exactly right. And even in TherapyNotes, you need to add the telehealth as a session or as a place of service. But within the session, the schedule, you're right. It's very simple.
Right. So hopefully that's not too difficult for people. So So one of the things that I know too we had talked about is, and I know this has been kind of a topic for a lot of folks just in our mental health space is telehealth going to become more of the norm now, in terms of meeting with folks?
Yeah, that's a great question. And I know, as a country, and even as Michigan, we're in Michigan. So as a state, we've gone through a couple big legislative shifts as far as what's covered. Gordon, I really hope so. Right. And I think that's something that providers can do a good job as far as, lobbying and advocating with their government officials on. Because I think it's effective. I think the outcome data is there to support that, and you can reach more people, right? And I know that insurance companies oftentimes get a bad rep, but the predominant narrative of Blue Cross, for example, or Cigna or Aetna or any of the really big ones has been access to care, right? Yeah. That's been a very large agenda item for them for a very long time. And that's something that this could really enable in the future. So I really hope so. And providers can, send a letter to your governor, your senator, and congressman and push for it.
Right. Well, one of the things about it that I've thought about is that I know for a lot of my clients, and it's finding that balance between the time as a practitioner. What are the hours that I want to work? And most everybody knows that if I only saw clients from 5 o'clock till 9 o'clock at night and on the weekends, I could fill my practice, just in the snap of a finger, because those are the premium times for most people wanting to come to see a counselor is, evenings and weekends, because they don't want to take time off work to come to an appointment. So, I think the opportunity is for those of us that are seeing folks that are working, they can see us via this platform, this online thing, and they're not having to do the travel time to get to your office. They can take time off, hopefully if they have a private place to meet, they can just meet with you in their office at work or whatever. And so I think it's going to be pretty appealing to people. And I think in terms of marketing your practice, again, like you said, insurance companies are pushing access to care. This makes us much more accessible.
Yeah, I agree. And there are some companies out there that, I think it's .com therapy maybe, that's the really big one, 100 so providers that just raised some Series A funding to really launch their stuff. And there are a couple others that are making some really good progress in the country as far as telehealth, but it's still, for the most part, underdeveloped. And the other market share that I would encourage people to think a little bit about is overseas, right? I mean, you have a lot of U.S. people overseas doing a variety of things, right? Whether that be oil engineers in the Middle East or, businessmen and women in China and India, right? That hour difference makes a big deal. So if you want to fill evenings, but you be, in your daytime hours, but maybe for them it's the evening, that's also not a bad idea, right? I mean, you can say we're the expats across the globe, and maybe for them it's nighttime, so they're more willing to pay privately for that.
Right.
There's a lot of options there.
Right. And I think that's a niche that really hasn't been tapped into that much yet for a lot of people.
I would agree. And, I don't know a ton of organizations that you could connect with. I mean, maybe you have some more ideas, Gordon, but I'm thinking we have a client that services patients all over the country, but their thing is somehow they've gotten connected to the oil companies. And so, whether that be in the Middle East or Alaska or wherever, they see expats remotely. And so that's been a really nice niche for them.
Right. That's great. Yeah. So, one of the things too, I know we were kind of chatting about is finding that balance between being, particularly during this season with the COVID things. And like I said earlier, hopefully we're starting to get towards the back end of this whole pandemic, but who knows? But, being able to find that balance between being profitable, but at the same time, not taking advantage of people, people that are out of work, out of their jobs and that sort of thing. And I know you had some thoughts about that just from your perspective, Jeremy.
Yeah. So one of the, I would say agenda items, but one of the things that's really important about taking insurance that we harp on a lot, and I harp on a lot, is collecting from patients. And I know that's a really uncomfortable topic because, you start to say, well, I do therapy and now I have to collect money, and that kind of blurs a line. And then you add the COVID layer, right? And so now it starts to look like I'm this profitable business that is just after money. But if your patient's claims are processing with a copay or deductible, and you're in network with that insurance company, you're contractually obligated to collect that. And that can feel like you're against a wall, right? Right. It can feel like, well, maybe this person's spouse is out of work, or maybe they're out of work and the cash flow isn't there yet, but I still have to collect a copay and deductible. And I want to offer a couple of strategies that can help with, one, the patient perception, but two, actually collecting that money. And so, as a business and as a business owner, one of the values that we have is treating people how we would want to be treated, right? So if I'm a patient and I have teletherapy because I need it, and I have a deductible that I owe, but maybe I'm short on cash, what I would want is for the provider to say, listen, you owe for the service, and that's true. I do owe for the service, right? No doubt about it. I would either want an extension on my debt, right? So whether that's, you know what, I'm going to push this out 30 days. I'm going to have a credit card on file, but I'm not going to run that for 30 days until we know how things are shaking out. Or let's set up a weekly payment plan, right? Where you're going to pay $10 a week, for the foreseeable future, so that I have some assurance as the clinician and as the practice owner that you're good for it. But also that you can bake that into your budget a little bit so that you can continue to collect. And so the patient can get used to knowing that that's there, I need to take care of it. That maybe the clinician's not charging me my $1,000 deductible, which is a huge measure of grace. But I know it's there, and I'm gonna take care of that in the future. So, providers, and this is even for good times, good advice, but you can set up payment plans for deductibles and copays, or you can push it. As long as you're making a good faith effort to collect that balance, then you can extend that, right? And we've done that with clients of ours that are saying, listen, this is tight, and it's like, I get it. I totally get it. Yeah. And so, we're willing to be flexible because we want people to feel cared for, and we do want to take care of them. But, you still have to run a business and you have to run a practice.
Right.
Have you taken a stance, or how have you handled that conversation so far?
Yeah, that's, one of the things that, is nice in just using your services is that a big part of it is you send out the statements for us. And that's a huge thing and something that we don't have to, I don't have to have that on my radar. And I think one of the things that you're right is that and I've had clients in the past where they've had like a high deductible and they owe that, and they want to pay it. But I think just being able to set up like a payment plan with them and say, okay, we're going to let me know what day of the month you want us to charge your credit card, and we'll set that up and do it that way. And I think a lot of people are just very, very much appreciative of that, and it's a good faith kind of thing. And I'll say this is that I think I know one thing that a lot of us in private practice, just counselors in general, therapists in general, because we're giving people and we want to help people, I think a lot of it has to do with our own money mindset. And that I think we somehow or another feel bad for collecting from people or getting paid for what we do. But if you think about it, you think about the years you spent in graduate school, the amount of money that you spent on graduate school, and getting your credentials and all of that sort of thing, what you provide is of value. And I think that people genuinely want to pay us for that. Yeah.
That's so true. I mean, people know that when they go to a doctor's office, they're going to owe something, right? And it's no different in therapy, right? If I were to go to a counselor, I know that I owe them something. And it's not just because I'm in billing, right? That's not the only reason why I would know that. But as a consumer of a service, I know I owe you something, and I expect to pay it because it's valuable. I recognize the value of it, and it makes a lot of sense, that way. And I think the big lesson there, not only on the money mindset side, but as business owners and leaders in your community, you have to manage tension, right? That's part of the shtick with, and know this from managing people for a long time, is that you just have to manage that tension as a business owner. And that's a really important reality that you have to make your peace with, that at some point you're going to make these decisions, and they may be the hard ones, but they're also going to be the good ones. Right. There's a really good book written by Paul Bloom called Against Empathy, which that title sort of incites a thing, right? But his whole point is that if you make business decisions or wide sweeping policy measures around maybe an isolated incident, it's actually bad long term. And it's a good thesis. I think it's worth reading. Right.
Yeah, I like that. Yeah. So to switch gears just a little bit, Jeremy, I know that one of the hot debates, regardless of this COVID thing or whatever, is a lot of practice owners really kind of trying to figure out whether or not they want to accept insurance or be credentialed or be on insurance panels. And so I think it might be good to hear from you just kind of the case for accepting insurance and why somebody might want to decide to do that. Because, I tell people up front, and you would too, is that it's much easier logistically to not take insurance and to not do all of that. But what would be the case for doing it?
Yeah, well, maybe I'll do you one better. Maybe a couple points for and a couple points against.
Right.
So a couple points for, clinically, you can work with populations that you're passionate about, right? So whether that be military personnel, active duty, or retired, and you want to take on TRICARE patients, that's a huge demographic and one with a lot of need. And, my mom, who actually helped push us into the practice solution stuff when she had her private practice, works for the VA, and it's something she's really passionate about. So if you want to work with a client population, that can be a really good thing, right? Medicare, Medicaid, TRICARE, if that's your clinical area of expertise, do that, right? Because you don't want to sacrifice that stuff. That's why you went to school. At the same time, right? So working with clinical populations that you want to work with is important. The thing you're going to sacrifice is profitability, hands down, right? If you're a cash pay practice, right, that charges $125 for $100, and you take Medicare, Medicaid, or TRICARE, almost for sure you're going to take a hit on the money side. So weighing your values as far as, and your needs too, right? Do I want to work with these clinical populations, and do I want to hit this particular revenue number? You're going to have to weigh that a little bit. And like I said, you're going to have to manage the tension between those two. Another case 4.4 is there is something to be said about access to care and that growing a practice, right? So if you take Blue Cross in a predominantly Blue Cross insured community, it makes sense that you're going to grow your practice a little bit more or a little faster than somebody who may not. And for the most part, Blue Cross and Cigna and Aetna are generally easy to work with. So it doesn't add that much burden to your plate to think about, and it's going to grow. So there's like speed and deployment, and your time horizon around deployment of mental health care matters, depending on your situation. But again, you're going to have to manage paperwork and a contract and a fee schedule and denials and rejections and some fuzzy bureaucracy. So that would be the thing you give up there. But on some of those insurance companies, for sure, the commercial side pays pretty well and pretty consistently. So that's another reason for, and I guess against, just dealing with the ambiguity. I would say another reason for is, again, access to care, right? We have a big mental health problem in the country. There's an article by CNN published end of last year, that said the life expectancy in the U.S. had actually gone down because of suicide and drug-related accidental death. That shouldn't be the case. I mean, that's for the richest country in the world. I have a hard time believing that should be there. And so I think that just the idea that we can provide access to a multitude of people makes a lot of sense. So a couple of reasons for and against.
Right. Yeah, and I think the other thing you have to weigh is, like you said, is providing access to people. And I think you have to look at the demographics of your community. I know I live in an area that, compared to other parts of the country, we're a lower socioeconomic kind of area. I mean, we're right here in the heart of Appalachia and surrounded to the north of us here, the coal fields of Southwest Virginia and Kentucky. And so that's a hard-hit area economically for a lot of people. And so their access to care is dependent on them being able to use their insurance to be able to pay for it. And so I think you have to weigh those kind of maybe kind of ethical issues out there as well when you think about that. And the other thing too is, at least what I've noticed is that if you do go onto insurance panels, particularly if you pick those panels that are the predominant ones in your area, you're pretty much guaranteed, a client base. I mean, you're going to get the clients, and so it's kind of an easy way to get clients to some degree. by doing that. So,
yeah, I agree. And it takes a little bit of a forensic and academic approach too, right? Because one mistake, one pitfall that I see a lot of new practice owners fall into, and we caution people about this all the time, is, they'll contact us and say, I want to get a network. I want to hire you guys to get us a network with 20 insurance panels. And our sales team will say, we'll like call a flag on that play. It's like, no, I don't think you do, right? Mm-hmm. Because that shotgun approach of let's just see what sticks, right, mm-hmm. will actually have the opposite effect of what you want it to have, right? Because now you have to manage all of the complexity of billing and credentialing with those panels, and you haven't even seen a patient yet. And so what we tell people all the time is, do your research, talk to some colleagues, talk to the big companies in your area, find out mm-hmm. where you want to be, and then make a decision on your end objective, and then pursue that. But don't take this like spaghetti on the wall thing, because it'll have the opposite effect of what you want it to. Right.
Yeah, and it gets complicated. The more panels you're on, it's just because each one is different in the way they handle things, and so you've got to handle each panel differently.
They're not created equal.
No, they're not. They're not. Yeah. So
it's pretty wild. How did you come to make those decisions in your practice?
Yeah, that's I appreciate you asking that. That was a tough decision for me, because I was at a point at one time where I said, I just want to be done with this. And just get off of all these insurance panels. And I think really what really turned it around for me is when I said, when I started looking at the number of calls we were getting and so many people asking if we could accept their insurance and that sort of thing, I thought, okay, what I'm going to have to really kind of resign my business model to is being geared towards higher volume. In other words, seeing more people in order to get the there, and then being able to also outsource that whole insurance billing part of it, because it is so time consuming. And I think maybe when somebody first goes into private practice, I think and they're going to be on insurance panels, it's a good idea to maybe do a little bit of it themselves just so they understand it and understand the workings of it. But once you reach a certain volume, and I don't know what that magic number is, you definitely want to outsource that in some form or fashion, because it will just eat up your time.
Yeah, so we've seen a couple of things around that. So I totally agree. I think providers should know how it works, which is why we have the model that we do, where providers can see exactly what we're doing in TherapyNotes so that they know how their business is running. I think that's critically important. Mm-hmm. There's not a business process that we have that I don't know on a rudimentary level how it works, and that's mm-hmm. on purpose. But what we start to see is around like 5 to 10 patients is when clinicians start to say, well, the amount of time I'm spending learning about this or doing it actually becomes less valuable than just outsourcing it, right? Mm-hmm. And the thing that we're trying to do, and we will continue to do in the future, is, we're adding services, right? So very soon, and we've got 22 days until patient support comes out, where we're going to start to collect money from patients and explain balances and send those texts and emails and pick up the phone and call your patients. That comes out in June, and we want to be an active part of taking the time burden off so that providers can focus on patient care. Mm-hmm. But it's around 5 to 10 a week is when providers start to say, well, I'm spending 5 to 10 hours a week on billing, but I could replace those 5 to 10 hours with patients and make significantly more than the time I'm spending here.
Right. Yeah. Well, Jeremy, this is, I know we could probably talk all day
sure.
about all this stuff and other things as well. But tell folks more about how they can get in touch with you and more about Practice Solutions. And we're going to have all these links in the show notes and show summary as well.
Yeah, I would love for people to get in touch with us by going to the Practice of Therapy website and clicking on our logo.
Yes,
because that redirects you to our website and the landing page where Gordon is featured, and some of the work that we've done together there. So that's one way. The other way is just going to our website, practicesol.com, And there's a contact box there that you can fill out. And we'd love to talk to you. Any member of our team is more than happy to sit down and talk to you. Our whole goal is to be a champion for your practice and to be an active partner in your growth. And so if even this week, we've said to people, I think you'd be a good fit over here, or this is a better process. And then some clients were like, we're a great natural fit, because our whole thing is about helping practices focus on patient care. And, we want to help you in any way that we can. And sometimes that means saying that we're not a good fit. And we do that all the time.
Right. Yeah, I know we'll have those links in the show summary. And I know I'm going to go ahead and give you two links that I know will work. One is just simply practicesol.com/Gordon, and that'll get you to the landing page for the Practice of Therapy. Or you can go to practiceoftherapy.com/practice solutions, and that'll get you there as well. So we'll have both those links. It'll get you the same place. And so be sure and check Jeremy's and Practice Solutions out. I mean, they are just, they are absolutely provide an excellent service, and I can vouch for it. And that's who we use in our practice. So, well, Jeremy, thanks again for being on the podcast. And I'm sure we'll have you back on to talk about other grand things.
Great. Thanks, Gordon, for having me. It's been a pleasure. It always is.
All right. Take care.
Yep.
Well, folks, I hope you enjoyed hearing from Jeremy. I know he is just a lot of fun. Haven't actually gotten to be with Jeremy in person, but I've had some interactions with him. He is just, he's got a wicked sense of humor, which I just love. But anyway, I'm so grateful to Jeremy for being with me on the podcast. And you can find out more about his company, Practice Solutions, if you'll just go to practicesol.com/Gordon, and that'll get you to the landing page for the Practice of Therapy. And you can talk to Jeremy and his folks about what they do in terms of insurance billing and insurance credentialing and that sort of thing. And the thing, too, I want to just kind of reiterate that Jeremy and I talked about is that I think you really have to maybe spend some time thinking about if insurance, being on insurance panels, makes sense for your practice and your demographics. I know for me, I went through just kind of an agonizing period where I was trying to decide whether to stay on insurance panels or not. And ultimately, I decided that it was in the best interest of my clients and based on the demographics of my area to be on insurance panels. And so I just, for me, it was an ethical issue to be able to provide that service to my clients. Nothing against people that are fully cash pay. If I could do it that way and it be beneficial for the clients, and also if I was in an area that could support that, I would probably do that. But again, you just need to decide for yourself about insurance. So anyway, again, big thanks to Jeremy. Be sure and check them out. Practice Solutions, and it's practicesol.com/Gordon to get you to their, get you to the landing page for the Practice of Therapy. And also just a quick reminder, be sure and, check out our sponsor for the podcast, TherapyNotes, therapynotes.com. And if you use the coupon code Gordon, just GORDON, that will get you 2 months free. So just be sure and check them out. And I'll say this, the session note helper that I mentioned at the beginning does not replace an electronic health record system or the functionality of what TherapyNotes does. It's just a way to kind of streamline kind of your note taking, your progress note taking, and it can be used in conjunction with the electronic health record system. It's what I do the majority of the time is I create the note in Session Note Helper, then I cut and paste it over into the progress note in TherapyNotes, just because it helps me word things the way I like to word things. So anyway, You can get to the Session Note Helper by just simply going to the URL, sessionnotehelper.com. It's got it set up that way, and that'll get you to the landing page to find out more about it. So I hope you have a great rest of your weekend, whenever you might be listening to this. Do take time to subscribe to the podcast, and wherever you might be listening to it, whether it be on Apple Podcasts or Google Podcasts or Stitcher or Spotify, any of those, you can find the podcast and subscribe to it and leave us a rating as well. It just helps us boost our ranking and helps other people find us. And do stay healthy and stay safe out there during these strange times we find ourselves in. Hopefully we will be through the worst of it. Hopefully there's not going to be a second wave. I hope that doesn't happen, but we just don't know. So, but anyway, take care, folks. Stay safe, stay healthy, and we'll talk to you again next week on the Practice of Therapy podcast. Been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free private practice startup guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.